So again, pleasant good afternoon to all of you. So to continue with our topic still on the introduction of pathophysiology, this is just a review. And the topics that I will be discussing this afternoon is very relevant when it comes to formulating your framework for pathophysiology. So we have actually, as a review of our discussion last time, we have discussed about the 6 characteristics of life. And what are the 6 characteristics of life? We have the organization, we have the metabolism, we have responsiveness, we have development, differentiation, and reproduction. So the 6 characteristics of life introduced to us on how we have the basic understanding on how the physiology of the body goes with the stimulus and response mechanism. It also explained in the 6 characteristics of life on how the body responded accordingly to changes and how the body adapts to those changes and stimulus as well. The homeostasis had been introduced to you during fundamentals of nursing, and obviously homeostasis is synonymous to equilibrium. When you are when you are in a state of health, you are also in the state of wellness, you are also in a state of balance. So when your body is functioning well physiologically, meaning if I'm saying well, it function accordingly to what is expected, then that is homeostasis. But when it comes to the point that when the body fails to adapt to some of the stimulus and changes in the environment, internal or external environment, then this comes to a point of the problem with disequilibrium. The state of balance is very important for all of us because later on we'll discuss about the chain of infection on how the state of balance when it comes to the physiologic response of the body are affected when it comes to the disease process or infection or chain or through the chain of infection. So actually, homeo is the same. Stasis is to stop, which means that this indicates a dynamic state of equilibrium. If we say dynamic state of equilibrium, the body adapts to various stimulus, internal and external. However, the body compensates to balance. Okay, just the same as with the basic concepts of the nervous system, specifically on the sympathetic and the parasympathetic response. So, for example, when you are engaged into a strenuous physical activity, then your body, obviously during exercise, stimulates the sympathetic nervous system. And when the body responded accordingly with sympathetic nervous system, the heart rate is increased. When the heart rate is increased, then it increases also oxygen consumption. Thus, at the end, may identify the increased oxygen demand. So when it increases already the oxygen demand, the body compensates to uh, consider the increased oxygen saturation by the response of the parasympathetic nervous system. And that's the time the heart will decrease its force of contraction so that to reserve also the oxygen that will be utilized by the body cells, specifically in the circulatory system and in the cardiac circulation as well. So that is a typical example on how homeostasis comes in. Another, why there are some situation, as one of my example in the 6 characteristics of life during metabolism, when when the body when the body considers the nutrients or the food that you have as an intake, it breaks down into nutrients. So these nutrients are being utilized by our tissues and cells. So when there are excess when it comes to the product as well as the waste product will be on the function of the excretory system. So that balances the mechanism of physiology when it comes to homeostasis. Another which considers that this situation is that of the process of when the food is considered as an intake and it was already utilized the needed nutrients by the cells and tissues. So the cells has also waste products. So the waste products can be excreted in various ways. So it could be integumentary, it could be to the GI tract, it could be to the urinary system. So what may happen if ever this supposedly waste products will be retained into the body? This may cause the possibility of toxic level, may lead to toxic level, and it could be harmful to the cells in the body. So that's why that comes in if there will be disequilibrium. If, for example, if waste product stays in the body, for example, urine, if there will be retention of urine in the body, and we all know that the urine may also have the presence of bacteria, may also have presence of excess minerals of the body that is supposedly excreted by the body, then once it will cause the possibility of retention, it may cause reabsorption, it may spread the infection to the body, or it may increase the possibility of some minerals and electrolytes as well in the blood, which may cause a harmful response to the body. So next po, when it comes other than this homeostasis is the concept we're in, it considers two general points of homeostasis. We have the what we call autoregulation or intrinsic regulation. If we say autoregulation, our organs of the body has this regulation that can't be controlled. Okay? This may respond accordingly as it is indicated with its function. Example, when the heart accepts blood, non-oxygenated blood from the venous circulation, then the heart will respond accordingly with negative pressure. Why it needs to have negative pressure? So that the venous blood enters freely to the heart. And then what will happen? The muscles of the heart will relax and will move outward. So that's the mechanism. Then when it comes to the systole, wherein the blood will be pushed from one area to another, so expect if it is from the ventricle in the right side, it will push through to the pulmonary artery, and if it is from the left ventricle, it will be ejected towards the aorta and leading to systemic circulation. And how this will happen? The autoregulation that we are addressing here is the force of contraction of the myocardium goes inward. Okay, goes inward to increase the pressure. Why it must need to increase the pressure? It may need to increase the pressure so that to push the blood to its indicated area. Okay, so that's why with our concepts of blood pressure of the systole and the diastole, we are aware that during the diastolic pressure, the heart is relaxed, the heart refills blood. And when it comes to the systole, that is when the heart contracts, and that is the time wherein contraction of the ventricles are expected to push the blood to its indicated area. So right side to the pulmonary circulation, left side to the systemic circulation. So the autoregulation comes from the word auto, automatic. Okay, you cannot control by yourselves, even by mind setting. You cannot control I may have longer systole, I may have shorter diastole, I may have shorter systole, I may have longer diastole. It's part of the system of the body. And it gives us the idea that it's auto-regulated because of the heart sound that had been produced. Okay, we have the lab dub. Okay, the lab dub. So the lab dub is an indication wherein we have a normal heart sound and normal closure of the various valves of the heart. So that's auto-regulation. You cannot control the opening and the closing of the valves. So another example, how about for the lungs? For the lungs, it processes oxygenation and ventilation as well through inhalation and exhalation. Can you control the entry of the oxygen? It may not be longer because the oxygen is needed by the body for gas exchange. Can you control the retention of carbon dioxide for an hour? The answer is no, because carbon dioxide is considered as a waste product that must be exhaled by the lungs. So on that note, there could be a possibility that if carbon dioxide retains in our body, it becomes toxic. Okay, if oxygen may not enter the body, then the body will be deprived from oxygen, and it will compromise the functions of the cell and the functions of the tissues as well. So this is what we meant rather by autoregulation or intrinsic regulation. Okay, so next, number two. Number two general points of homeostasis is extrinsic regulation. Usually, the most common system, the two most common system that are uh, introduced when it comes to extrinsic regulation is the results of the activity of the nervous system and the endocrine system. Okay, what's the reasons why the nervous system and the endocrine system? We all know that nervous system is the one that is responsible for impulse transmission. Okay, with the basic concepts also of the sympathetic and parasympathetic nervous system. Now, when it comes to another extrinsic regulation on endocrine system, most common major organs that we consider here are glands. And these glands produces and secretes hormones. The hormones are the ones that are considered as on the extrinsic regulation. Okay, so what's the difference between the intrinsic and the extrinsic regulation? In the intrinsic regulation, you cannot hold. Okay, you cannot hold the physiologic response of the body. It's an automatic response. While in the extrinsic regulation, it may depend on the response of the nervous system and the endocrine system from a stimuli. So an example, endocrine system, how about let's have an example when it comes to uh, thyroid, okay, thyroid hormones. Okay. For thyroid hormones, for those who may have problems with goiter or hyperthyroidism, it's very obvious that the result of hyperthyroidism is increased thyroid hormone. When we go back to our discussion that if there will be increased hormonal stimulation, it may increase also cellular metabolic activity. If it may increase cellular metabolic activity, it may increase cellular activity. And that cellular activity may lead to the possibility to increase electrical impulses. So when that may happen, the increased thyroid hormone is with the endocrine system. Then how nervous system comes in? The nervous system comes in because of the increased metabolic response of the cell. It increases also the response of the cell when it comes to electrical activity. So what is the common organ that are affected with hyperthyroidism or goiter? Usually it's with the heart. Okay, the heart is one that has been affected when it comes to hyperthyroidism. The increased thyroid hormone may cause the possibility of the increased stimulation of the heart contraction or forceful contraction of the heart because of the neurotransmitter, because the neurotransmitter beta 1 had been increased to stimulation. And once the beta 1 the beta neurotransmitters will be stimulated, it may increase and induce the increase rather of force of contraction of the heart. That's why if you will notice and if you're aware, for those individuals who may have hyperthyroidism or goiter, they're the ones who are experiencing palpitations. Okay, so have you seen the connection between the nervous system and endocrine system that is specifically considered as extrinsic regulation? It's not automatic. Okay, it's not automatic. There's an underlying condition that may specifically affect hormones, or that may specifically affect the stimulus or stimulation of the nervous system. So another example of extrinsic regulation. Okay, uh, let's have a comparison. Will your heart continue to pump, lub-dub, systole, diastole, even though you eat or you did not eat anything? So the answer is yes. For 24 hours, your heart will keep on pumping and contracting, and follows through the systole and diastole contraction and relaxation. And that is continuous even though you are not eating or you eat anything. So that's intrinsic. When you eat food, your heart will still continue to pump. But when you eat food as a matter of food intake, the food intake itself may cause the possibility of stimulation of the nervous system. To what extent? Because you have introduced food to your body will respond accordingly from the food to break down into beneficial nutrients. And with that, to break all of this, the food intake that you may have is through the digestive activity. So the digestive activity could be more effective if the nervous system will stimulate the parasympathetic response, cholinergic, or acetylcholine. So that influence not just only the digestive system, but the nervous system is influenced because you have introduced food, and the digestive activity had been influenced through the stimulation of the what we call nervous system. So that is what we call extrinsic regulation. Okay? Do you have any questions so far on the difference between intrinsic and extrinsic regulation? Any questions, students? Students, any question? Any questions so far?
Wala na po.
Wala po.
Okay, so I will continue. So to continue with our discussion, the homeostatic regulatory mechanism is conceptualized by what we call receptor, control center, and effector. Okay, we always consider receptor as receive. Okay, receive. That is stimulus. When it comes to effector, that is specifically on the response. Okay, so the cause, the stimulus is the receptor, the effector is the response. What is the control center? The control center is the one that processes information, and we all know for a fact that the brain, okay, is the control center. Usually processes everything when it comes to the physiologic response of the body, the functions of the different organs and systems are that's why it's called the central nervous system, because the functioning of the body is centralized accordingly by the brain. So that's why if the brain could be affected, it is expected that it may lead to multiple organ dysfunction. So as we all know that, for example, I may proceed to the next slide probably. So for example, the homeostasis, the body regulates normal body temperature. Okay. But how the body regulates it? So it's through the help of the circulatory system, to the help of the brain, through the hypothalamus, through the metabolic response of the body, circulation. So these are the different systems of the body that regulates body temperature. However, there are some situations that it may rise body temperature depending on your activity or depending on any deviations that your body may have. Kasi usually when you experience fever, that's an indication that either your body is responding to a normal response or your body is responding to deviation. So if it is related to infection, related to inflammation, that is basically one of the response of the body which you may be alert of. But when the increase in the temperature is brought about by your awareness, caused about by a specific activity or any food intake, then you are aware. So you will just consider the normal response of the body as it will uh, regulate to its uh, temperature of the body, normal temperature of the body. While when the body is having infection or inflammation, that's the time that the body may not control and regulate the temperature, so we'll supplement it with the pharmacological management. So that's why when it comes to the stimulus of the rising body temperature, the receptor itself by the hypothalamus, okay, the hypothalamus is basically will respond, and the stimulus accordingly is with the temperature that the body is experiencing rising, continuously rising of the body temperature. The information, so receive, so we have the stimulus, the information now affects the control center because the hypothalamus and the temperature of the skin interpigmentary is the one that gives signals that there's something wrong with the rising of the body temperature. So receptors. Then this information goes with the control center. With the control center, this is now how the body will decrease or will sustain or will normalize the body temperature. So the control center sends command to the effectors. And what are those effectors? So the effectors could be the skin. So that's why to one of the ways to decrease the temperature is for the body to have sweating through the integumentary system. And basically for a stimulation of the blood vessels to have good circulation, they also regulate the temperature. So that's why we are aware also that the circulatory system is the one that regulates temperature. And what is the response from the heat loss? Okay, the heat loss is brought about by the sweating, goes back again to the normal temperature. So this basic response on the body temperature is very relevant because this gives us the idea that when there is always a stimulus, it will always be there will be always a response to compensate and balance it. So the control center, which is the brain, is the one that may control or that may regulate the some deviations and return it to normal as well. So next, let us now proceed to what is pathology. So we have already started what is physiology. Actually, when we talk about the pathology and from the term itself, pathogens. Okay, pathogens are the ones that causes any microorganism, virus, bacteria, or any agents, infectious agents that may cause a disease is a pathogen. And when we talk about the study of causes and effects of diseases or injury, then this is all about pathology. Usually, we are aware in the hospital that we have pathology department. Okay? The pathology department in the hospitals, it is wherein it will analyze microscopically some of the laboratory and diagnostic examinations if there are cells and tissue changes. So that's why in pathology department, it can count number of cells, it can count how many red blood cells, white blood cells, and how many platelets are counted accordingly through the use of the microscopic analysis. It may also analyze the tissues through biopsy. So this is how pathology comes in. And it may identify now that in pathology, it will give us the idea of what is the cause. When we go back to the framework of the pathophysiology, usually you indicate risk factors at the above portion. Okay, the above portion, or the portion that is always been indicated at the first of part of the framework of the pathophysiology is always you consider risk factors, non-modifiable, modifiable, precipitating factors, or contributing factors, and these are the what we call causes. Okay, so but if it is caused by a certain microorganisms or certain caused by parasites, viruses. This may specifically identify how the cells have been affected through pathology. And when it comes to pathology, there are also some areas which specifically may identify the changes of the disease organs and tissues. In pathology, it focuses on physical changes. This is a typical example of a lung, okay, of lungs, okay, lungs that are affected with smoking. Kaya for those who are smoking, look at these lungs in the slide. These are the lungs that in the future may cause an effect specifically on the changes you may not see, you may not feel now, but in the future when your lungs will be tested, if you have started in your early age smoking, or you have increased number of cigarette intakes, so this may cause the possibility that the harmful substances that are part of the composition of the cigarette smoke may harm to your heart. So that's why most of this cigarette smoking may specifically not only cause one respiratory disorder. It may cause a possibility that it may develop chronic obstructive pulmonary diseases or disorders. So it may lead to emphysema, uh, uh, asthma, bronchiectasis, and bronchitis. Okay. So these are chronic obstructive, from the term itself, chronic. We have differentiated before the difference between acute and chronic. Chronic is considered a severe condition wherein the changes and damage that had occurred to these specific organs are already a high level of worse condition. So physical changes on these organs and tissues, it may give us the idea if the cells are continuously damaged in the tissues brought about by the cigarette smoke. If there are cells that are supposedly expected and described accordingly with lung cells, but it turned out into the biopsy that it appeared that there is a different structure or a different image that had been identified. So that's the time that the interpretation could possibly lead to a tumor or abnormal growth of cell. So another diagnostic examination may be recommended to identify if it is benign or malignant. So can you give me another example, sir, of physical changes when it comes to disease organs and tissues in pathology? For example, brain. Okay, on the brain, when the possibilities, or it was confirmed, rather, if it was confirmed that the client has manifestations of meningitis. Okay, the meninges are the protective tissues of the brain, and once uh, the infection comes to the brain, then this may, we all know, they cause a possibility of a very fatal condition because it may lead to multiple organ dysfunction, or the the virus itself may spread throughout the body and in a fast pace. So, but since when you consider this meningitis, when you are exposed to meningitis, it's somehow fatal because once you been exposed to these conditions, it may directly affect your brain. And when it comes to that person who had been affected with and diagnosed with meningitis, there could be a possibility that the damage that may occur to the brain can be analyzed through pathology. So again, just the same as physiology, we have also pathology that may study specifically the cause. For example, if we go back to the concept of cell physiology, special physiology, system physiology, and pathological physiology. If we say cell physiology, it's obvious that it studies about the action and parts and the function of the cell. When we talk about the special physiology, this focus on the organ. System physiology, this identifies how the functions and processes are identified with the system and common organs, major organs involved in the system. But when we talk about pathological physiology, this talks about the disease. This talks about the cause. So a combination. okay, of what causes the deviation from normal physiological response through a specific cause. And the study of the cause and its effect is through the pathology. So just similar with what I have mentioned with the lungs and with the brain, this could identify disease organs and tissues. Another is we have the what we call surgical pathology. The surgical pathology, the difference with the first one is it studies about disease organs, physical. But for surgical pathology, this is a branch of pathology which primarily focus on examining tissues with the naked eye or under a microscope with definitive diagnosis of disease. So what are those can be observed by the naked eye? For example, uh, patients for OB, patients with myoma. Okay, the mass that are present in the uterine cavity or in the uterine wall may be seen as an abnormal growth of tissues by the naked eye. But it can't be identified if it will be uh, what you call this cancerous, which is malignant, or benign or non-cancerous. But with the naked eye, that is already an abnormal growth of tissues that formed a mass in the uterine wall. That is myoma. But to consider that myoma, if it is benign or malignant, that's another microscopic analysis for a definitive diagnosis of disease. So what do you mean by definitive diagnosis of disease? The definitive diagnosis of disease, if it is a benign or malignant. So another example is when some of you experience the what we call gastroscopy. From the term itself, gastro, it involves the stomach or the GI tract, but specifically the gastric gastroscopy is upper GI, referring to upper GI. Oscopy is visualization. Okay, but in one of the step that they are using is it has the capacity or capability to pick tissues for analysis. So if the doctor wish to know for a definitive diagnosis of the cause of the possible response of the stomach when it comes to indigestion, when it comes to bleeding, then tissues can be tested through a definitive diagnosis. So that's what you call surgical pathology. Possibly the patient undergone a specific surgery, then afterwards it could be identified for another test for a definitive diagnosis. The definitive diagnosis that we are talking about is the final diagnosis. Okay? So another surgical pathology. Patients who may have breast mass. Okay. Palpation of mass in the breast is not normal. Okay, when there will be an abnormal growth, new growth of abnormal cell, and that is tumor. So by the naked eye, if it is removed from the surgical procedure, it's very obvious that the presence of mass is not expected in the breast. So to give a clear definitive diagnosis, the mass could be subject for what? Could be subject for definitive diagnosis if it is benign or malignant. So that is surgical pathology. Okay, any questions so far? Okay, so feel free to ask questions. If none, I'll proceed to the next slide. The next is what we call cytopathology. Okay, the cytopathology, from the term itself, cyto, it talks about the cells. It is the branch that studies and diagnoses disease on the cellular level. A while ago, we have talked about the surgical pathology. The client will undergo the surgery, and the changes that causes with the abnormal tissue growth can be done through the surgical pathology. But to identify its definitive diagnosis is through cytopathology. That's why if you will encounter terms, nurse, please send this for cytopath. Cytopath. The cytopath means that there will be the specimen could be sent to the laboratory for further study if this mass or any mass or fluid could have presence of abnormal cells that are not expected. Example, the cells that I have mentioned to you a while ago when the client undergone myomectomy. So the myoma itself was sent or will be sent to cytopath so that to identify its definitive diagnosis for benign or malignant. So, sir, how can you differentiate with the surgical pathology? The surgical pathology is the client will undergo the surgery or any minor procedure to retrieve the specimen, either fluid or mass, and will be sent for definitive diagnosis. When the specimen has been sent for cellular, for studies and for definitive diagnosis in the laboratory, that is what we call cytopathology. So another example, when is the time that, for example, when we extract uh, when we do lumbar puncture, the lumbar puncture, obviously at the back, is to retrieve a specimen such as cerebrospinal fluid. Okay? To basically identify if in the cerebrospinal fluid there are cells there that may be identified, such as red blood cells, white blood cells, and other significant findings that may have definitive diagnosis. If, for example, in cerebrospinal fluid, it is not expected that RBC is increased. So if it in cerebrospinal fluid, if there is RBC, increased RBC, so obviously there is bleeding. If in the cerebrospinal fluid analysis, there is a specific presence of WBC, then obviously there is a problem with infection. And another is if there are other findings that there are presence of bacteria that have been identified, then this is a possibility of problem with infection of the cerebrospinal fluid. So that is what we call cytopathology. We are studying the cells that may exist into a specific specimen brought about by the surgery, brought about from surgical pathology, and the cytopathology is the process on how the cells will be analyzed from the specific specimen. So next, we have molecular pathology. For molecular pathology, this is more just like the same with the levels of six structural and functional organization of the human body. When we talk about molecular pathology, it usually emphasizes the smaller component of the organs, tissues, or bodily fluids. When we talk about molecular pathology, there are situations that molecules are being studied simply because this may identify if your cells in the organs, tissues have normal response towards the body. Okay, because any function, any dysfunction or cellular dysfunction may affect another tissues, another organ, and another system. If we say molecular level, this is more on the chemical, okay? It may study the chemical activity of the cells that are present in organs, tissues, and bodily fluids. That's why when we go back to the six characteristics and functional organization of the human body, molecules are on the chemical level. Okay, if you can still remember that. But when we talk about pathology, if it studies about the cause and the effect based from the study and diagnosis and examination of organs, tissues, and bodily fluid, focusing on molecules, then this is molecular pathology. So this is a more deeper understanding on how may specifically identify. Another example, uh, the how can a variant, ayan, this is very timely. How can the specific variant of COVID-19 already penetrated the population of the community? It's through molecular pathology. Through molecular pathology, it identifies the difference between the UK variant, the African variant, or the first variant that had infected from Wuhan, that had infected the general population. So this concerns with the molecular pathology, because how can they identify that? Because they can identify that because of the different uh, structure and appearance of the virus. Second, it's the extensive damage of this variant to the tissues and organs. So this may identify the difference that the Wuhan COVID-19 variant and the UK variant has different level of communicability. Okay, so it was mentioned from the studies that UK variant may be more communicable compared to the Wuhan COVID-19. Okay, so those are being studied through the molecular pathology, and the virus is the cause, and how it will cause extensive damage to the systems of the body, specifically the respiratory system. Now, when it comes to pathophysiology, a subject to explore on the rule of origin and evolution of disease process. Okay? When we combine pathophysiology, we're talking about the cause, we're talking about the effect, it talks about how the normal physiologic response is being affected from the specific cause, or what you call pathogens. So when we combine patho and physiology, the specific cause, which is pathology, because we have mentioned that this is the study of cause and effect. So we identify the causes. When we go back to your case study and case presentation, you always take into consideration that the cause of the cause of the changes with the normal physiologic response of the client is based on the causes and from the data coming from the physical examination findings, patient health history, previous hospitalization and surgical history. So those are the environment as well, modifiable and non-modifiable. So those are the concerns of the pathology, the cause. But when it comes to its effect to the imbalance, effect to the it caused to what extent it caused the problem with this equilibrium, then that is pathophysiology, because when it will not be controlled accordingly, the deviation, it's either it may lead to fatality, or if therapeutic regimens such as pharmacological, surgical could be identified and implemented, then this may lead to chances of recovery. So the prognosis could be specifically identified. If we say prognosis, these are the chances of recovery or the chances of the patient's condition that may lead to a high level of the severity, or worse, may lead to death. So this is the disease process. Now, when it comes to the pathophysiology, let's start with a typical example of stress. We all know that stress uh, it may affect specifically the system of the body. When you have increased level of anxiety, when you are in stressful events, there are many things and many things that is happening in your body, and there are responses in your body which you have identified. There could be when you are on the stress level, you may have problem with GI. When you are on stress level, it may affect your focus. When you're stress level, it may affect your stomach conditions or gastric condition. When you are on stress level, it may affect your intestinal response. When you are on stress level, it may specifically affect the the response of the integumentary system. So this is a typical example of how stress may lead to altered motility. Okay, let us now identify. It starts with the stress, and the stress usually cause an effect with sympathetic response. Okay, what are the effect on the sympathetic response? For digestive activity, low digestive activity. Sympathetic response, increased heart rate. Okay, sympathetic response to the bronchi, it dilates the bronchi. So those are situations that may speed. Another example for the gastric, it may increase the chance of the increased hydrochloric acid. So that's why for those who may have experience stress, there are situations like it reflux to the upper GI tract. So usually those individuals who could who may have high level of stress or experience stressful events are those situations that may also lower your immune system. To what extent that it will lower your immune system? During stressful events, we have the what we call cortisol. Okay, cortisol that is being released by the adrenal glands, which could cause harm to the body. Why? Because the cortisol may cause the immunocompromise to the body. It may decrease our immune system. So that's why the various infections could be vulnerable to that person, or various infection could be high risk for that person. So during stress, it may cause the what we call brain and genitourinary tract dysregulation. If we say genitourinary tract dysregulation, the brain cannot anymore may not control anymore the regulation of the different organs of the body, and the gastrourinary tract may cause its discomfort. And usually that causes the discomfort when you're experiencing stress. Some of you experience abdominal distension, some of you experience diarrhea, some of you experience the frequent urination, some of you experiences bladder distension. So those are disequilibrium that may happen to your body unexpectedly. So when it comes to this aspect, if you will notice that the stress may affect the altered motility of the intestines. To what extent? Can you imagine that the bile may cause malabsorption? This is by liver. There could be also a possibility that gastrointestinal microbiome, or the 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 capacity of the stomach to increase hydrochloric acid and destroy the bacteria, may significantly reach the intestines. Okay, so that's why your stomach has high level of hydrochloric acid, because it has the capacity to kill, okay, to kill bacteria and viruses. So the higher chance the higher acidity level, the greater chances that it will protect you from infection. Okay, so that it may not affect the intestine. But if during stress, this may cause the possibility of the problem with that protection. So this is a typical example of the somehow may lead to response ng body. Another, serotonin, altered endocrine metabolism, hormones. So serotonin is considered as neurotransmitter that balances our mood, that balances our behavior, emotions. Di ba? When you experience during stress, there are also problems with thought process or focus. So that's why this may cause also emotional outbursts, uncontrolled behavior, because your serotonin is decreasing. Your brain is having the problem with the regulation of the serotonin. So this is a typical example of pathophysiology that started from the stress and may cause the possibility that you may have altered intestinal motility. Usually, pathophysiology, it study the study of functional and physiological changes that the body in the body that result from a disease process. So functional, if we are aware, I have already introduced to you the different systems and organs of the body, and you are aware of the normal functions. So if it caused the physiologic changes brought about by a certain cause, by certain pathogen that result to disease process, then that is what we call pathophysiology. So combination of the cause and its physiologic changes to the body, that's pathophysiology. That is different from pathological physiology that we have mentioned. Pathological physiology is, it studies about the disease process as a whole. But since if it is combined as pathophysiology, you will think of the normal to deviation and how the body is affected by the certain cause. So that is what we call pathophysiology. This is a typical example of the difference between a person who may have a normal airway passages and from a person who may have asthmatic attack. So probably some of you who may have asthma here, you are aware of various causes of how you will experience asthma attack. So a typical example is allergic or hypersensitivity reaction. For example, when you are exposed to dust, these are pollens and may cause an allergic or hypersensitivity reaction. This is the normal radius of the bronchi, the normal radius. But once you are exposed to the allergens, okay, the allergens, what happens is that it may cause the thickening of the wall of the airway, because the normal airway is supposed to be a relaxed smooth muscle. But when the wall is being affected by the presence of the allergens, these uh, muscle cells will be thickened. Okay? And since it will be thickened, that's the start of inflammation. And when it continues to inflame, this is what happens. It becomes the smooth muscles become tightened, and the narrowed airway of the bronchi is expected. So for those who may have asthma attack, once you have been exposed, very very immediate and sudden ang effect when it comes to the narrowing of the airway passages. So that's why asthma attack could be fatal, because it may totally cause the closure of the airway passages. So through pathophysiology, you can illustrate this is the normal structure by anatomy. By physiology, it it follows through the entry of the freely of the oxygen and removal of carbon dioxide. But when there will be asthma attack, what may happen is that person could be deprived from oxygen because the airway passages are narrowed, and possibility of carbon dioxide retention, okay? And if there will be carbon dioxide retention, it may not be helpful because it may lead to toxic level of carbon dioxide. So this could cause harm to the blood as well, because it will be more carbon dioxide rather than oxygen will be carried by the blood. So this ends with what we call pathophysiology. So probably we'll start with the next topic. So I will stop my sharing. Okay. So the next topic is all about the disease process and all about the chain of infection. So I will now share to you again the slides for the chain of infection. Any questions so far from the topics of the that had been discussed? Any questions? Okay, so is it clear? Thank you so much. So let me now proceed to the next topic pertaining to the chain of infection for a while. Are you already seeing my screen? Is it already projected? Oh,
Wala
not
pa
yet.
po.
Okay, so for a while. So I'll share it again. Okay, that's it. So let us now proceed to the topic 3. So is it now projecting, students? Is it
Yes
now
po, meron na.
projecting? Okay, thank you so much.
Opo.
So the topic 3 had been posted already in your MCUBLE for your reference. But for the meantime, let's continue with our discussion. Let's start with how we define infection. Okay? Okay. We define infection as it refers to an invasion of the body by harmful microorganism or parasites. The severity could range from mild to fatal. Okay. Actually, the invasion itself could be justified and validated if there will be a specific test that will definitely identify the specific microorganism that causes harm to that individual. And if we say infection, it is brought about by harmful microorganism or parasites. So it could be bacteria, it could be parasites, it could be virus. Okay. So it is mentioned as infection already if it completes the manifestations as being observed through the studies. Just like for the COVID-19 infection, we are aware that most common manifestation for this COVID-19 infection are on the respiratory tract. Okay, so if uh, there are other organs affected, that is secondary when the respiratory system already affects and relate to other organs or systems of the body. So that is what we call infection. When it comes to the chain of infection, um, the chain of infection starts with infectious agent, reservoir, portal of exit, mode of transmission, portal of entry, and susceptible host. Actually, the existence of the nurse in this chain of infection is to break the chain. Because when you are aware that, for example, when it comes to COVID-19, the infectious agent could be transferred from one person to another person. There are still no studies that COVID-19 can be can cause infection from an animal. So since we have identified the infectious agent, we must know how this could lead to the possibility of affecting the reservoir. The reservoir that we're talking about is, since the COVID-19 may cause infection to humans, then might as well we consider humans as one of the reservoir. So in this situation, how do we break this infection agent and may affect the reservoir? So later on, we'll try to discuss on how to break the chain of infection. And this is very important when it comes to pathophysiology, because this chain of infection will give us the idea on how certain conditions or health conditions may lead to the possibility of why individuals are identified as highly vulnerable, why individuals are identified as highly susceptible, what are the different means of transmission. So those are being studied, just like in our situation now, a public health emergency. They have gathered those analysis and information through the concept of chain of infection. And one of the examples that I may introduce to you later is how to apply the chain of infection to COVID-19. But for the meantime, let us now identify what does infectious agent mean. Infectious agent is considered as the pathogen. Okay, di ba? Pathogen we have considered as the cause. And with this cause, it could be a germ, it could be bacteria, it could be virus, fungi, or parasites. These are infectious agents. While when we talk about reservoir, this includes places in the environment where the pathogen lives. Okay, di ba? That's why it's very important for you to do hand washing. It's very important to you to do hand hygiene. It's very important to you to practice minimum health standards, because eventually, di ba, there was also a study that the COVID-19 stays in objects. Okay? There are some studies that COVID-19 stays when transferred or when exposed to person, it stays how many hours or to what extent that it could be infectious. So the reservoir could be either people, animals, insects, medical equipment, soil, or water. So that's why even in soil, microscopically when you touch soil, earth soil, you can see if there are any microorganism there. But when you analyze it by microscopic analysis, then you will see the various bacteria or sometimes parasites that could be present in earth soils. So another example for insects. Di ba, when we talk about dengue fever, the Aedes aegypti mosquito carries the dengue virus. So it means that the Aedes aegypti, the mosquito, can be also as considered as reservoir. Another mosquito is the mosquito that carries the virus of malaria. That could be one also. So there are also situations that if you have heard about the Ebola virus, this comes from the what do you call this? Comes from bats. So that serve as the reservoir. For the, if I'm not mistaken, during the time that there's also a virus that affects the Middle East. Okay, the MERS-CoV, that's the MERS-CoV. The MERS-CoV, they have identified that it came from camel and the bats. So these are reservoir which may possibly carries another even the migratory birds, right? Di ba avian flu? The migratory birds may carry the virus, and once you will be exposed with their manure, the manure itself is one of the source that you will be exposed and have acquired those viruses. So this could be reservoir, but most that we are aware are people. Okay, that once you may have, for example, bloodborne disease. For bloodborne disease, you may have hepatitis virus. You may have human immunodeficiency virus. So HIV. So these are carried. You may consider that person as reservoir. Okay. So these are number two, reservoir. Next is the portal of. I'm sorry. Number three is the portal of exit. The portal of exit is the way infectious agents leaves the reservoir. Okay. So for example, uh, for HIV. So we are aware that the infectious agents is the virus of the human immunovirus. The reservoir is the person who may have the virus, the carrier. Now, when the person, since the virus runs through the blood, runs through the bodily fluids, when the person will have a contact to other person with open wound or through sexual intercourse, the portal of exit from the reservoir could be to what extent? Bodily fluids. For example, the 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 person who may have an open wound, okay, and to a person contact with open wounds and the blood had been exposed, so chances that could lead to the portal of exit. That's portal of exit. Another is that of when uh, sexual intercourse itself, since the one of the bodily fluids are the semen, then this could be transferred to another person and may circulate to that person. So that's the portal of exit. From the reservoir, it leaves the reservoir, then goes to other person. But the way it goes to other person through means of coughing, sneezing, saliva, these situations could be considered as portal of exit. Yung exposed with bodily fluids, aerosols, okay, the virus spreads through the air, open wound or skin, direct the virus or the bacteria exposed and have chance to be transferred through that means. So the portal of exit, again, let's start with the first one. The infection agents are the pathogens. Okay, the pathogens could be virus, bacteria, fungi, parasites. Number two is the reservoir. The reservoir could be the environment wherein we could identify where the pathogens may consider a carrier. It could be animals, it could be people, it could be direct objects, it could be directly from objects, it could be fomites. So those could be reservoir wherein this pathogens may stay. And when the time that this virus, bacteria, parasites, and the pathogens leaves the reservoir through the means of open wounds, through the means of coughing, through the means of the exposure to bodily fluids. That's the portal of exit. When we talk about the mode of transmission is the way the infectious agent can be passed on. Okay, can pass on. So it could be direct or indirect contact, ingestion, or inhalation. Okay, can you give me example of direct or indirect contact? Anyone, based from your assignments, can you differentiate direct to indirect contact or give me an example of direct contact or indirect contact? Anyone?
Pag direct, pag
Okay.
direct po, may skin to skin contact. Pero
Okay,
kapag
very good.
indirect po, maaari pong mapasa kahit wala pong skin to skin. Like, mga, yung droplets po, ganyan.
Okay. So, yung thank you very much. I think the answer came from Miss Byong. That is correct.
Yes po.
Thank you so much. The direct contact may have the skin to skin contact wherein, for example, the transfer or the passing of the pathogens or the infectious agents from, for example, skin to skin. So that is direct contact. But when we talk about the virus, even on a distance, okay, on a distance, had been transmitted to you. Kaya nga, that's why it has been identified that you must at least have 1.5 to 2 meters so that you may not be infected for those persons who may have COVID-19. That is the acceptable distance for you to prevent the transmission. But if you may have a close contact less than 1.5 from this person, then that could be one way of what we call uh, indirect transmission. But once you have closer, okay, closer itself, and the transmission itself is from it may not be the droplet anymore. It could be direct, could be the blood transfusion, or probably the through the sexual intercourse. Those are direct contact. The indirect contact is through the what we call, even on a certain distance, aerosol. It could be aerosol, it could be by inhalation. So those are. So it could be ingestion. Okay, ingestion example, contaminated food. Di ba, that's why we have hepatitis A. Contaminated contaminated water. Contaminated food and water, the chances you may have typhoid fever. Okay, other than contaminated food and water. So these are more on the what we call ingestion. Okay, the inhalation, or aerosol is there could be possibility of both droplet or both inhalation that the virus may suspend through the air and could be transmitted to you. So these are the mode of transmission. Next is the portal of entry. Okay, the portal of entry is the way infectious agents can enter a new host. So, uh, sir, what's the difference between the portal of exit and the portal of entry? The portal of exit is that of from the reservoir, the carrier. Okay, the carrier. There are means on how the carrier goes out from the carrier. So, that's why as what I mentioned, the carrier, for example, is mosquito. Okay? The mosquito is a reservoir wherein it carries the dengue virus. Then the dengue virus, then the mode of transmission. So how is the mode of transmission? The mode of transmission is through di ba, the mosquito bite, and that mosquito bite itself transfers the virus. Okay, transfer the virus to the circulatory system of the person. So how it will happen? The mode of transmission is direct. But the portal of entry when it comes to the dengue virus is it may cause the possibility that through the broken skin, the virus had been introduced towards the circulation. That's already the portal of entry. So the infectious agent can enter a new host, another yeah, for example, COVID-19. For COVID-19, it was identified infectious agent is the SARS-CoV-2. Okay, before the SARS-CoV-2. Now, the reservoir as mentioned is the bat, as according to the Wuhan study. Then from the bat, it enters to how it leads to the ano to the what you call this portal of exit. The portal of exit is from the bat, then the virus spreads through the fluid, okay, of that bat. Then after the portal of exit, the mode of transmission. So from the mode of transmission, it's either direct or indirect contact. So either. Then the portal of entry is the where the COVID-19 enters to the body is via respiratory tract. Okay? So the portal of entry could be broken skin or incision, respiratory tract, mucous membranes, catheters, and tubes. Okay. Why catheters and tube? Any tube that had been inserted to individuals could be chances of risk for infection. Why? Just like for Foley catheter, it has been inserted via the urethra and to the urethral canal. Do you think from the external environment, microorganism may transfer through that tube and enters the body? The answer is yes. If the person has endotracheal tube, the tube that has been inserted and connected to the mechanical ventilator to facilitate and assist breathing, that tube is directed towards the respiratory tract. Is there a chance that microorganisms or pathogens may travel through that tube and enters the body? The answer is yes. So this could be the portal of entry. How about number 6? Number 6 is susceptible host. This could be any person, the most vulnerable of whom are receiving healthcare. Ayan. Immunocompromised, have invasive medical devices including lines, devices, and airways. So the susceptible host is a person who could be vulnerable. Kaya if we say susceptible, vulnerable. That's why when we try to prioritize individuals who will be vaccinated, we have identified who are most susceptible. Di ba? We have identified priority 1, we have the healthcare practitioners. Priority 2, those who are the elders or the older population. Then goes with the next priorities. Because these are informations that comes also from the chain of infection. Because let's face it, the healthcare may have the direct and indirect contact for those who are infected with COVID-19. Why second are considered as the older population? Simply because they are the ones who may have decreased immune system and may have weak defense against infection. So that's why they're the second one who are subject to be vaccinated because they are vulnerable. So in this scenario, this is how you will break the chain. I have introduced to you the chain of infection as well. But the question is that of how it will break the chain. Okay? So just like for the infectious agent, viruses, bacteria, fungi, parasites, how could break the chain? Break the chain through diagnosis and antimicrobial stewardship. What do you mean by antimicrobial stewardship? It's through prophylaxis. Okay? Prophylaxis. The term prophylaxis are medications or drugs that are being given to individuals even though they do not have yet diagnosed, they have not diagnosed yet, they may not have definitive diagnosis, but it could be preventive. That's one of antimicrobial stewardship. Another, for those who have been bitten by dogs, we all know that the dogs may carries the rabies virus. So what could be the preventive what could be the preventive measure? The preventive measure is that of you must have also to complete the vaccine to prevent rabies. Another situation, if there are wounds, okay, if there are wounds, okay, wounds, so sometimes the doctor may advise you antimicrobial topical ointment because that is also preventive. So that's what we call antimicrobial stewardship. As long as you have already identified the infectious agent, you can break the chain through the antimicrobial stewardship. More so, it may give us the idea on the when you are aware of the infectious agent to know specifically the diagnostic test could be the one. Okay, for example, situations like in infectious agent of COVID-19, why is it very necessary and recommended for you to have the gold standard of PCR test rather than antigen test? The antigen test can only identify if your body is responding from infection. But on the RT-PCR test, this is the gold standard wherein it identified actually that there are presence of virus, of the COVID-19 virus in your body, and you are infected as well. So when you're infected as well, what will be the measures that you will do? You will do isolation, you will strictly follow minimum health standards, you will subject yourself for quarantine. So you already break the chain. Okay? So, and you subject yourself already to treatment. So, when you are on the infectious agent level or causative agent, you are already identifying how you will protect yourself and how you will protect others. Next, reservoir. For reservoir, we have dirty surfaces, people, water, animals, insects, soil. Okay. For the reservoir, the breaking the chain is obviously by doing disinfection. Okay? So disinfection, di ba? That's why when we apply disinfection agents, familiar kayo sa mga brands na Lysol, sa mga brand na these are mga strong disinfection agents that will minimize the growth of the microorganism. So they will just wipe those tables, those other parts of the facilities. So another is pest control. Okay, so kung pest control, then usually they do fumigation, di ba? In the communities. So that yung mosquitoes when they do fumigation, they keep away from those Aedes aegypti that carries dengue virus. If you can still remember those measures. Another is sterilization. Sterilization is basically the total killing. Okay, total killing of the microorganism. Disinfection is it may kill but not totally. Okay, it may prevent. Okay, it may prevent the growth, but to totally kill the microorganisms, this is sterilization. This is done usually when you will be assigned in the operating room. All of the equipments that will be used during operation are free, totally free from microorganism, and sterilization is done through autoclaving. Okay, autoclaving is the process, the machine itself, and the process of sterilizing equipments. So this could be free from microorganism, totally free. Disinfection is it inhibits. Okay, so this could prevent the reservoir to break the chain. Next, portal of exit. Portal of exit, if you will notice, from portal of exit, mode of transmission up to the portal of entry, common, very common, they are very common when it comes to the breaking the chain. Portal of exit, hand hygiene. What are those hygiene? The hand hygiene could be through the hand washing is number one. Hand rub. Hand rub is one through the use of alcohol based. Okay, alcohol based. And other disinfection agents. So another is breaking the chain is through the use of PPE. PPE, personal protective equipment such as the face mask. Okay, we have the face shield. We have the gloves. Okay, the gloves. We may have the put covers, and we may have the full gear body suit. Okay, so those are the personal protective equipments. So another is control of aerosol. So we're talking about the portal of exit, control of aerosol. So how will you control the aerosol? So cupping etiquette, yeah, respiratory etiquette. Okay, so you will what you call this, you will close your mouth or your nose when you are coughing. Another is waste disposal. Waste disposal is putting or segregating. That's why we have infectious. Kung meron tayong uh, uh, when you're disposing your waste po, you must take into consideration the proper segregation because there is also a trash bin that considers infectious. Okay? So on that matter, let us now proceed with mode of transmission. For mode of transmission, it's the same. We have hand hygiene, PPE, food safety. Sa food safety, because when we talk about ingestion, food safety, proper preparation of food, proper cooking of food, and proper presentation. If we say proper, safe. Okay? Safe preparation of food, safe cooking of food, safe presenting or presentation of food. So that's why we are very cautious about this, on about food preparations and presentations, because by ingestion it could be by mode of transmission. So cleaning, disinfection, isolation. If you will notice, among the chain of infection, the breaking the isolation is in the mode of transmission. So that's why how you will prevent transmission, you will isolate yourself 14 days and be observed of the signs and symptoms of COVID-19. Another, isolate any communicable disease or infectious diseases are subject for isolation. Moreover, if you are living, if some of the members who are infected are living with homes who are small, having a small space and congested family members. So these are chances that it may lead to the possibilities of the no. If you will notice before that we have advised the home quarantine, but it's not anymore advisable because it may not be the resources may not be available at home, or the correct implementation of isolation practices may not be implemented. So that's why quarantine facilities are being established in most of the communities now. Now, so when it comes to breaking that chain of portal of entry, so the same hand hygiene, PPE, this is what we call now this is where we consider the first aid already. When the manifestations are already identified, when is the time that manifestations are already identified? When the portal of exit comes from the reservoir, mode of transmission, from the portal of entry, once it enters the body already, it manifests now the what we call signs and symptoms. And that's why wherein the first aid are being given na already. Okay? So that's why it's very important pa lang that in the infectious agent pa lang, preventive measures must be done. You must be knowledgeable. But once you enter in the portal of entry, wherein the persons are already been infected, then first aid are already must be a protocol. Removal of catheters and tubes. So that's why it's when the patient has been hospitalized, most of the supplies is supposed to be disposable. Okay, we consider it disposable because of chances of cross infection. Actually, syringes are disposable. You're aware of that. Syringes are that syringe needles are disposable. Catheters must be on a certain period that can be used and be replaced because it may cause chances of infection. So that will be on the portal of entry. And while on the susceptible host, this is the time for you to consider. This is the time for immunization, vaccination, treatment of underlying cause, COVID-19 protocols, health insurance. Health insurance, what they're referring to health insurance is here in the Philippines, we have the PhilHealth that may cover such. And patient education is very important for the susceptible host to prevent complications already. If those who are infected, then this must be break this chain so that to specifically not undergo again going to the infectious agent and goes to another process of chain of infection. Okay? So are there any questions? So I think it's almost, if I'm not mistaken, it's almost 6 o'clock. So we will continue our discussion on the disease process and chain of infection. This is the most interesting part that is supposed to be part of our discussion. I will apply the concept of chain of infection when it comes to COVID-19. This has been discussed by Dr. Cleopatra Aquino in the Philippine Nurses Association local convention. But we will continue this by next week. Okay? So do you have any questions so far? Any questions? So I will stop my sharing.